It used to be the case that ACL reconstruction surgery was reserved for young athletes, and people over the age of 40 years old were recommended to undergo non-surgical treatment. However, improved surgical techniques, and higher expectations of athletes in their middle and later years has led to an increase in the number of surgical reconstructions being performed in people's 40s and 50s, and even beyond. Individuals in this age group considering ACL reconstruction should have minimal arthritis in their knee joint. If they have more extensive arthritis, then ACL reconstruction is generally not beneficial. Surgical treatment of a torn ACL in someone in their middle-aged years is similar to the treatment in a younger population. Options for surgical treatment are similar, including options for choosing the type of graft used to reconstruct the torn ACL. In younger patients, a much more significant difference between the use of someone's own tissue and donor tissue has been noticed, but that has not been found in people who undergo ACL reconstruction in their 40s and older. Recent research has led to the recommendation that young patients in their teens and 20s have ACL reconstruction using their own tissue, rather than donor grafts, because of a lower graft failure rate and lower infection rate. However, in people older than 40 years old, donor tissue has not been associated with an increase in re-tears of the ACL. For that reason, most patients in their 40s and older will choose donor tissue when having their ACL reconstructed. The results of ACL reconstruction in people older than 40 years old have generally been favorable. When compared to people who chose non-surgical treatment, those who have had their ACL reconstruction surgically were found to perform more athletic activity and had less ongoing knee discomfort. The complications and risks associated with ACL reconstruction are similar to those seen in young patients.